chronic infestation with schistosoma is a risk factor for a bladder cancer. Hi there. Today I want to talk about this infection with a parasite called schistosomiasis. So a parasite simply means an organism that cannot survive on its own. It needs another organism for feeding and shelter. So schistosoma is basically a parasite, and there are various species, so different subtypes of this parasite, but mainly they cause symptoms within the intestinal tract or the urinary tract, so too. But then, how do humans get this parasite? The infective form of this parasite is found on freshwater snails. So when humans get into contact with this freshwater, and I talk about freshwater, I'm referring to ponds, lakes, rivers, right? So rivers where you have these freshwater snails, there is a potential for these freshwater snails to have the infective form of schistosoma parasite. So this infective form penetrates the human skin, right? And by some complex mechanism, because the life cycle is a bit complicated, but I'll break it down as simply as possible. It finds its way either in the intestinal tract or in the urinary tract. Once a human is infested with this parasite, it can cause symptoms. So sometimes you will not have any symptoms. Okay, so acutely, when I talk about acute, I'm talking about short-term occurring within a week. You may not have any symptoms. When symptoms do occur, right, you can have maybe just a skin reaction, like itches around, the area where the penetration took place. Other symptoms, could include, maybe urinary symptoms like frequent urination and things like that. But I want to focus more on the long-term complications of in the intestinal tract, right? It can, cause an obstruction within what we call the portal circulation, which is simply blood circulation, blood flow within the liver, and can lead to an enlarged liver as well as an enlarged spleen. These are two major organs found within the abdominal cavity. Okay, but let's go to the urinary tract, which is where I really want to focus this. It can cause urinary symptoms, like I said, frequent urination, a painless hematuria. So painless hematuria simply means that you're passing out blood in the urine. So typically you have reddish urine, right? But you don't feel pain when you pass out such reddish urine. It's very important that you don't ignore such symptoms. Very important you seek medical care. I say this because chronic infestation with schistosoma can lead to, it's a risk factor for a bladder cancer, right? So if you're having symptoms like that, and you are endemic in areas where you have fresh water, like lakes, like ponds, rivers, and frequently carry out activities in these fresh waters, it's important that you seek medical care, because schistosoma can actually cause serious complications. So if you found this video helpful, why not give me a like, and watch out for my next video. Thank you.